program. I hope you enjoyed so far. I was asked to give an overview of what we are doing in the male's health, because somehow we are really slow in this field. I'm very sorry for this, but we are overwhelmed with many other applications, and somehow we still didn't support the urology or male health program enough. So when people talk about male health, when I was doing this presentation many years ago, I found this journal, Men's Health. So I said, okay, this is probably what we are talking about. But you can see here some very young people in good health. Probably they are not really candidates for our treatment. There are more people like me and guys in this picture, which are coming into the ages when the problem starts. In that period of time, I was Googling male health, and you can see here in 0.6 seconds, it's 4.6 billion hits about male health. So it's a big issue, obviously, very interesting issue. I was also looking into the top health risks for men, like heart health, respiratory diseases, alcohol, and so on. It is also interesting to see what are the causes of death for people. It is different for different ages. You can see it for young ages, it's injuries and even suicide, but later on, if you survive all of this and come to my ages, then it is heart and cancer and chronic lower respiratory diseases, and especially now in COVID time we had this a lot of respiratory diseases. We are more sensitive than female, so we are expiring earlier, as you can see here, at least 5 years earlier. And what we are doing here actually, it starts, I will tell you the history because I think I have enough time today. We were working somehow, very, how to say, by chance, by project, but not really systematically, on erectile dysfunction, urinary incontinence in men, and chronic prostatitis. So in these three applications we had some work done, some tools developed as prototypes and so on, and also even published some papers already. So let's start with erectile dysfunction. I'm sure you all know what this is, but anyhow, these were the sources of my learning about this maybe even 10 years ago. One of the main reason for the problems is the reduced decline of testosterone by ages. I'm quite old, so you can imagine that I'm somewhere at the end of this line. This is not very visible slide, but I took it from some other place, and the single concern or complaint for which people are coming to the doctor, male people, is here shown to be erectile dysfunction, and the second one, low sex drive. I was surprised by this, in fact, but this is some statistics, one of the statistics. Definition from this encyclopedia or handbook about sexual health is that this is consistent inability to achieve and maintain an erection sufficient for satisfactory sexual activity. This is the simplest definition, and also you can see this kind of symbolic icon showing the issue. One of the scale which is commonly used, and you can find it in different studies and also in literature, is hardness score, which gives you 4 categories. The first is that penis is enlarged but not hard. Second is that it's hard but not hard enough to penetrate. And then third is hard enough for penetrate but not completely hard. And fourth stage is completely hard and fully rigid. It's quite simple scale, and this is of course a self-assessment scale. In Asia I saw this kind of illustration of this scale, starting with tofu and going through bananas to the cucumber. So it can, of course, have different etiology. You can see here that it can include organic, cytogenic, and combined causes, and when it is organic, the majority of them is vasculogenic, and this is actually the major problem with vasculogenic. You well know that you are here 2 big reservoirs for blood, for cavernosa, and out of this chart, vasculogenic is about 70% of all the problems that are causing organic erectile dysfunction. This picture is from 2014, so exactly 10 years from now. This doctor is from Egypt, his name is Zdenico, he's 2 she treats a lot of men. On the training, she asked me if she can do anything for male, and she had some idea that actually doing the intraurethral treatment with erbium, you can solve the problem of dysfunctionality of the veins. And as I was developing many years ago endovenous laser treatment for varicose veins, I knew that it will not work, and especially not erbium. And secondly, if you are inside the urethra, you are far away from your veins, which are just under the skin on the top. So I told her that this is not working, this is not a good concept. But she was very persistent, and she said, please, if you can make me a cannula like you have for the females, intraurethral cannula, but just longer, I will try it. So we did. You can see the cannula, it's 26 centimeter long, and it was made for male urethras. And she went back home, and after 3 months, she called me and she said, you know, you have been correct regarding the veins, but what I discovered is that erection is getting better. That was really puzzling for me. Anyhow, I asked her to do the small study. This study was presented on the World Congress for Sexual Medicine in 2016 in Beijing. And later on we were upgrading this thing through some improvements of the protocol. Here she achieved about 70% in average increase in so-called peak systolic velocity of the blood pumping into the corpora cavernosa. I was also puzzled with this kind of test. I don't know if you can see it well, but there are measurements before and after on both bodies, on the left and the right corpora cavernosa, and you can see this influx of the blood. And this measurement lasts half hour. So I asked her how you can do this in half hour to keep this erection. And they do this test with the injection, of course, of prostaglandin, and they produce, like with Viagra, directly into the corpora cavernosa. And I was in her office in Cairo looking into this kind of treatment, this kind of measurements. So 2 years after, she already did, we optimized the protocol with single erbium, still smooth mode, and she presented this on our meeting, but also on another meeting, World Congress of Sexual Medicine 2018, and they're obviously every 2 years. This is a picture from her ultrasound, so you can see these peaks. This is a feeling of the blood, and you can measure this very nicely. So here, after optimization of the protocol, she achieved already 48% average increase in peak systolic velocity, which is better improvement than just 17% at the beginning. And I asked her also to use this erectile hardness score, but their urologists there, they suggested another score, so it was from 0 to 5, 6th grade in fact. And according to this scale, these patients actually were in category 0, 1, and 2. You can see there, these are the blue bars. This was before the treatment, and then the red bars are after the treatment. And you can see that about 23% get the highest score, which was really nice to see. The next step, of course, I was thinking about what is happening there. What is happening if you are irradiating inside the urethral, inside the male urethra, what is happening with this smooth mode erbium. And in that period of time, we were still guessing about additional mechanism of smooth on the tissue. We were a long time aware that we have this slow increase in temperature, which is causing the hyperthermia and shrinking and remodeling of collagen. But we are not fully aware about this heat shock biomodulation, which is happening because of very sharp, short pulses. In smooth mode, we have a train of 6 pulses, and each of these pulses is producing about 200 centigrade on the surface, which are too short to produce any damage, but cells are detecting it, and then cells start the mechanism of wound repair, although there is no wound, and it gives you a better effect and also deeper effect than the hyperthermia, slow hyperthermia, which is going about 500 microns deep. So with this we can go millimeters deep with this heat shock biomodulation, and later we discovered that this is the obvious mechanism why it is working, smooth mode inside male urethra. But at that time I didn't know that yet, and then I said, well, we should do something for improvement of the vascularity, capillaries in corpora cavernosa. Let's use piano transdermal. So this was like second step in 2018. And this gave us in the first small study on 10 patients just to test the concept, dual mode laser treatment, smooth plus piano. It gives us additionally almost 10% improvement. So it was really great to see these effects. And also if you are looking at the same scale they used before, you can see now 70% of patients gets the hardest score. So it was really great. And this was shown also on Photona Symposium in 2018. Somehow we get stuck there. It was COVID and whatever happened. She's treating patients still on, but the study is not running on. Meanwhile, Professor Okui, who had to leave, so he left already, he published a case. He was observing what we are doing, and he published a case in Journal of Lacha. This case is open access, so you can read it. There is a link there. He had a patient after the stroke, and it was a hemiplegic patient, and he has effect of this also on dysfunction, erectile dysfunction, and incontinence. So he used the transrectal approach using the smooth mode with the P03, and then you have this LA adapter at the end, the angular mirror, so you can reach the prostate and you can treat it transrectally. And he actually really good result, improvement in this patient, and he was surprised by himself. As he is a very productive man regarding the papers, he decided to write a joint paper with Dr. Hebakov about approaches. And you can see here 3 approaches which we are using for these treatments. One is intraurethral, the second is transdermal, and the third is transrectal. So these are the things which we have tools for. And if someone is interested to do some study, of course we will be interested also to support. And then there was a COVID time. Not much things were happening in the sense of traveling and stimulating and pushing the studies. But in 2021 we had the first post-COVID Lacha Symposium. Majority of it was online only. And this is Japanese Dr. Senda, Motohiro Senda, who actually did a very nice study. I was not aware of the study at all, but this is the guy who was using shock waves already for 5-6 years, also doing some small studies with shock waves. He was curious to see how laser is working, and he took like 15 patients in to treat them. And he started firstly with this combined treatment, intraurethral and transdermal, but then after some complaints of couple of patients, because intraurethral is not so gentle, we put a lidocaine cream inside the urethra before, but still. So after some first initial experience, he continued just with piano. So 13 out of 15 patients were treated just transdermally here. He did a 4 to 6 sessions and with 2 weeks interval. Here you can see the output picture. It's actually the video. If you're interested to hear this lecture, it's accessible. So you just go to Resident Health Academy and find Dr. Senda. So one of the comments in conclusion was that it's good to shave the hair, because the hair has different absorption than the skin, and then when the beam is going across the hair, it is of course absorbed by hair and then disturbing a little bit the effect. Not much, but little. So here he was comparing his experience with the shock waves with the laser now, and he was looking here for so-called IIEF scale. This is the erectile dysfunction scale, international one. A short form has, I think, just 5 questions, and it's quite simple. And you can see here that actually shock waves and laser both are improving the erectile dysfunction. And why he has 2 lines, because he was having a patient without PDA5 inhibitors and with. So even patient under these inhibitors were treated or without, but in both cases he saw the improvement. And then when he was comparing the shock waves with the laser, which you can see here on the left side is shockwave, on the right side is laser. What is the difference in this scale? Electron function scale, the lasers were much better, significantly better than the shockwaves. And I don't know how much you are in this field, but shockwaves are quite recognized already. A lot of neurologists have them, use them, and there are quite some articles about it. So I was very pleased to see that in the first such comparison, the laser were better here, so just piano. He was looking into hardness scale as well, and here also he showed this comparable, approximately the same. And when he was asking patient, because this patient firstly had shock waves and then after some time also laser, 11 out of 12 patients will select laser for the next treatment. So it's very stimulative, small pilot study. Unfortunately, it was not published. I hope we will still succeed to make some deal with him to publish this paper, all the pilot study. Now, regarding urinary incontinence in men, our good friend Adrian, and I just see him coming into the room. He has friends in one urology clinic in Mendoza, Uroclinica, and they tried first time this intraurethral approach to reach deep down to the both sphincters and to help with the urinary incontinence in men, especially post-radical prostatectomy. So these are usually older men, and not many good solutions are there for them. So they did also some kind of visual inspection of the urethra with standard endoscopes before and after the treatment, because we were doing this in this first attempt, we were doing this blindly. But then we find out that it's good and necessary to see how the urethra looks like and what is happening. So we developed the prototype, which consists not only on laser cannula, but also in the same cannula you can introduce the endoscope. And then you can firstly take a look into the urethra, take the endoscope out, put the laser in, make the treatment, and if you need, go again with the endoscope to check if there is any bleeding or whatever. So this set, I called it R100, so just a working name. I think we produced quite some, maybe even 20, and distributed among the interested investigators, and we get quite some feedback from the field, but not real study, except one in China. On this picture I'm with Dr. Pedro Torresillas from Malaga, Spain. He was very keen to do the study with this, so I went there. You can see 2017, and we were doing the treatment on a smaller group of patients, and then he was not really happy with this consecutive observation, shooting, observation. He said, I'm used to observe all the time. When I'm shooting, we need a real endoscope, and we developed, together with some German company, this, let's say, small endoscope, although I was a little bit horrified to see almost 7mm endoscope to be pushed into the urethra. But this endoscope has the biggest hole was for laser cannula and fiber, and the middle one, blue, is the endoscopic camera, and left and right, the small ones were for irrigation, so that you can wash the urethral wall. And actually we tested this year after in the clinic, and you can see the images of urethra through this endoscope, which are simultaneously going on with the treatment. And he was using some irrigation, and I tried to persuade him not to use the liquid, because liquid is actually eating out the power of erbium YAG. Erbium YAG is very absorptive in water, so if you have a lot of water, a lot of energy will be lost before it reaches mucosa. So he then started to use higher parameters to compensate for the loss, and it worked somehow. Before we were working like 1.5 joule. When he was using occasional irrigation, he went up to 4 or 5 joules per centimeter, and then it compensated for loss of energy on this water film. There are some details, and you can see here a case before and after, how this first sphincter at the end actually gets shut, not losing much urine anymore. So he presented also on our meeting first results with this tool, and also in the same year there was ICS Congress in Atlanta, and we were there together. This was, I think, the first presentation of our laser used for male incontinence on such big event. So on this 10 patients, what he was observing, among other things, he was observing number of pets. These are all severe cases, these guys. You can see there that more than 3 pets per day were used before. And then 6 patients remain only with 1 pet per day, and 2 patients were without pets for this 4 months follow-up. So it was really a great result after this treatment. Then he was increasing the number of patients and also followed them and observing also some other parameters. So in 2019, we had 20 patients to present. You can see that median age was like 63 and so on. Results, here you can see ICIQ and 24-hour PET test, both reduced, and these are results 7 months after the treatment on 14 patients. Very nice result, and subjective improvement. You can see that majority of the patients says that it is much better or better. So PETs reduce significantly, comfort increase significantly. So really encouraging data here. In that year, in 2019, in Japan, there was a huge interest there for all of our work in neurology. Zdенko University planned to do a randomized controlled trial. So we're doing this preparation. This is their protocol. We cannot understand it, but maybe some colleagues from Japan are here to understand it. And unfortunately, COVID happened, so the study was not really started. But these doctors were doing some other things, I will show you. Meanwhile, in China, people using the sets which were delivered there for trials, for investigation, did the studies. This is Professor Lu from Shanghai, and he presented the first pilot study results in October 2019. We had these meetings like Lhasa symposium, but it was regional, Lhasa symposium in China. In 2019 he presented his results. So he was treating about 22 male patients, all of them in ages already suffering of SUI post-prostate cancer treatment. And he did, I think, 4 sessions. You can see here what he says. He was using 24-hour PET test and ICIQ. You can see the quantity of urine, 156 grams. This is really severe. And ICIQ 15.6. And then after the treatment and follow-up, it was 5.7, so significant decrease in ICIQ, and also number of grams went to 58. So he said that after 4 sessions, the improvement reached 81%, 82% almost, and none of the patients has any adverse effects whatsoever. I think this pilot study was published in China in Chinese language, but we were motivating him to continue with larger number and then to publish in English. So this is the article, which is already written, just it is waiting for publication. We are looking where to submit it. So it's now a total of 79 patients. This is a randomized controlled trial, and in which the other group has a biofeedback measurements, and the test group has these 4 sessions of intra-erythral smooth. Results were very nice, so we are looking forward to see this paper published. And then the team from Zdенко University, this is Professor Fourier, they got the chair, they got a magnetic stimulation device, and they were looking into effect, they were testing it. So in, I think it was 2022, he was presenting results on the male population, also for urinary incontinence, fecal incontinence, erectile dysfunction, and they were finding some nice results. This is a change in bladder capacity by star format. Satisfaction was like more than 50% in all these categories. Overactive bladder after prostatectomy reduction also shown, but these are small groups of different indications. This is about urine leakage improvement and so on. This is for erectile dysfunction. I think it was just a case of 67 years old male, and you can see the improvement in all observed categories. These talks are all in the library of Laser and Health Academy on the web page or in the application. You can take a look into them. And then last year they continued with work. This is a young Dr. Kobayashi from the same team, and he presented results of urinary continence after radical prostatectomy, but now already on 53 men, followed for 6 months after the treatment, and they were using standard tools for measurement like ICQ, overactive bladder score, and so on. And they delivered 8 sessions, so they did 8 sessions of hits, and they find out improvement in urinary storage symptoms, and in people with younger ages and lower BMI, they get a better improvement than with the older men. So this is also available to watch and to listen to it. So something is happening, but it is not with the pace and with all of these plans that we had in the past. And the last one, chronic prostatitis. I will not bother you with prostate, what it is and how it looks like, and what is the prostatitis, but what is interesting is actually this chronic prostatitis, chronic pelvic pain syndrome. It's quite common, and incidence is very high, so people in my ages suffer from this quite a lot. And again, we start with Adrian. He was the first one pioneering in the same Euroclinic in Mendoza. They were treating people for prostatitis, and he also presented, you can see already 2018 in our meeting, and then with the posters on many congresses. Results are very nice. The yellow bars are improvement after laser, and the dark blue bars are control group. So you can see that control group was on tadalafil. You can see that it was equally good or even better. And after these presentations, he wrote a paper, and we published this paper together. Oops, in this very important journal. This was a journal of ICS, and it's neurourology and it's neurology, urodynamics, yes. So I was very happy to see it published in this paper, because earlier when we submitted to the same paper, they were against the laser, and no matter what we write, they didn't read it at all. They said, laser is not working, and we just reject. So it happened in 21, the first publication of use of erbium YAG smooth in the chronic prostatitis with very nice results. Dr. Kopp, aside of erectile dysfunction, is also treating the chronic prostatitis, but she took from the beginning a transrectal approach. So for her, we produce a little bit longer this LA adapter with angular mirror, and she was presenting in 2019 on European Congress of Sexology here in Sexual Medicine here in Ljubljana. 42 patients treated with, I think in this time 3 sessions with 1 week apart. And she was observing with ultrasound, she was observing the vascularities and also the size of the prostate. And she got very nice improvement. Circulation vascularity was improved significantly in the patients, and also volume decreased. If we are looking here into this kind of categories like weak, normal, increased, markedly increased vascularization, you can see that red bars prevail after the treatment. Almost more than 90% went into the category increased, markedly increased. What does it mean? You can see on these ultrasound pictures. So they are counting the vessels, and not only counting the vessels, but also looking into the size, cross-section, and then they are making a kind of estimate of vascularization of prostate. This is a case of, let's say, increased before weak, and the previous one was weak on both sides. And this one is markedly increased. It's quite obvious how much of these vessels appear there. These were improvements for more than 2 or 3 grades, quite nice. A strong improvement in this particular application. This is individual results. Actually, every patient except 4 improved, and it was 48 patients, 50 patients. And the other component was the volume. So you know that with ultrasound you can estimate the volume of the organ. and these are percentage of decrease of the volume. Because when you have chronic prostatitis, the volume of urethra increase, and you can see here that majority improved for about up to 20% and up to 30%, but some even more than that. So objective measure, vascularity and size of prostate. Dr. Miauchi, he is with us. I'm not sure if he's in the room, but he arrived to this meeting. We become quite nice, good friends. He started to treat people with the magnetic stimulation. This is his presentation from the 22nd, year 22nd, and he was treating a certain number of patients, and this is like first report, first experiences. Again, this is on Lacher webpage, you can see. He's showing here the case of 70 years old male, and doing a 16 session. He did 16 session on this man, and parameters used and the results. So on this particular case, you can see that, for example, this chronic prostatitis symptom index went from 21 to 9, which is a really great decrease. International prostate symptom score from 19 to 6. Quality of life also improved, and overactive bladder score again significantly. So the first experience was very promising, and he's working on this. So to conclude with this part, actually with the smooth mode we started, we included also piano. So with these two modalities we are working on these three indications, and we have some initial very promising results, but we need of course to work on this deeper. I'll just briefly mention at the end that from many years ago, when we still use erbium YAG in surgical mode, we have another applications which are in use among our users, and there are genital warts, removal of genital warts not only in female but also in male, balanitis, and circumcision. So this removal of condyloma is quite common, it's normally going on, and it's quick and easy. Balanitis is a quite nasty disease, infection, a fungal infection. It doesn't want to go away very easily. And the light pill with erbium YAG of the glans penis is solving the problem with a single session. This is a paper from Germany 10 years ago, so this is one of standard procedures. And finally, circumcision. This case was done, not only this case, but series of cases in Indonesia by a doctor who is doing this regularly, and in the past he was doing it with a CO2 laser. And his comment in this article, which is published in Journal of Lacha, is that we're starting using erbium YAG in their clinic because we can achieve shorter downtime and fewer complications. So, laser already have their place in male health from some time, but now it's expanding. Aside of this classical application, there are quite some new therapies, and of course for us it is still, after 10 years, just the beginning of a long and exciting journey. Thank you for that.